My name is Shelley Wright. This really happened at the Royal United Hospital, Bath, England, on the 13th of November 2017. This series of letters were part of my post-traumatic stress disorder therapy to help process the events of that day and what has happened since. It shows that it's just not the traumatic event that is important, but how things are handled afterwards and how recovery may be impeded. I'm hoping that they can be used as a training aid for psychologists, mental health students, healthcare workers, and anyone involved in critical incidents. Healthcare workers, do not let this happen again. Listen to your patients. To Dr. H, Dr. S, ODP C, and student G. This was written on the 30th of the 12th, 2018. On the 13th of November 2017, I was on B32 at the Royal United Hospital in Bath, awaiting a hysterectomy. I started to bleed pre-op and went on to have a cardiac arrest while in your care. Over a year has passed and I still have no answers from anyone involved as to why this was allowed to happen. I'm writing to everyone involved to let you know how the entire event felt. The subsequent non-resolution in 2 complaints meetings, ombudsman referral, and the lingering post-traumatic stress disorder. I want all of you to know the consequences of your actions or your inactions do not end on that day and have far-reaching effects. To Dr. H. You came to see me at 8:30 in the morning on B32 with your anaesthetic sheet. I had not had an operation in 35 years, but was calm and relaxed and just wanted it over with. I felt very comfortable with you. We were chatting about me being an A&E nurse and about working on a trauma team. On the front left of the anaesthetic chart, you wrote 56-year-old female and then A&E nurse after it. I had had problems bleeding PV and had been a patient at the hospital the previous day and had been given tranexamic acid, which had stopped it. My haemoglobin was also recorded, my notes were very thin, and these were clearly visible. I spent the morning reading a scientific journal, and when I thought I would be called to theatre, I went to the toilet. When I sat down, I suddenly started to bleed PV. It was a constant fast drip, and I sat very still hoping it would stop. I soon realised I was going to be in trouble without quick intervention. I knew the bleeding point was internal and the only way to stop it would be IV tranexamic acid and to open me up. The toilet was now full of blood and I had filled the yellow bag with bloody tissues. I slowly walked to the nurses' station nearby. There were at least 4 nurses, healthcare assistants there, and I said, "I am bleeding badly," which they all heard. Nurse D was the only one to come to my aid. There were only 3 other patients in the department and the staff all sat doing paperwork. She gave me a large green Inco pad and then put me into a room where I was not visible to any staff. As a really well-experienced nurse, I expected her to do a set of observations and escalate me. To my horror, she went off and cleaned the toilet. I could hear the whole process. It took her 5 minutes, lots of scrubbing and 3 flushes. How did she not realise she had the start of an emergency with all that blood? I sat there still as I could, trying to keep my respiration and pulse rate down. I was absolutely terrified. It felt like I was in a training film and I was waiting for someone to hit the pause button and say, "What should be happening here?" This was just not right. I was not out in the woods asking a random member of the public for help. I was on a ward with qualified staff and I should have been safe. And I was not. This horrible mixture of disbelief and terror whilst trying to stay calm. Emergencies don't happen in emergency departments or in intensive care or coronary care because staff are anticipating them. They happen on units where staff are complacent and think they only have safe, well patients and where they think they know better than their patients. When she came back into the room, I asked her to escalate me to you. She said I needed to be in theatre, it was the best place for me, but she did nothing to get me there. She came back a further 2 times, and on the 3rd occasion I told her I was an A&E nurse and she had to escalate me. I heard her on the phone, but I could not hear the content. She then came back and said that theatre was ready and I would be collected. I sat there as still as I could, looking at the clock, whilst another 35 minutes ticked by. During this whole episode, she did no observations and did not check my blood loss. So how could she have escalated me properly? What did she say to you to make you not be in the least concerned? Did she just say she had an anxious patient who had insisted on an escalation, although she was all right? Did she tell you about the blood loss in the toilet? Did you just make the decision yourself because you were in charge? Did you all just find it funny and tiresome? I have to ask these questions because to date no one has answered these for me. Why did no one act on my concerns? I had no idea at the time that Theatre 10 was so close. Why did no one from B32 think to push me down? And likewise, did not one of the four of you think to come and pick me up? I was that close. It was such a relief when the porter arrived and wheeled me up. I thought that at least I'd be safe with a well-qualified team. You would see the blood and realise the emergency. As I was pushed through the door, I said, "I am bleeding badly." You all stood there and ignored me, and I immediately realised that I was not going to be safe. You had Inco sheets spread over the trolley and asked me to get up so you could put the epidural in. I sat there in survival mode. I cannot even begin to explain to you how horrible and harrowing it was, knowing that I was soon going to collapse at the hands of my colleagues. It is something that should never happen to any patient. It would never have happened to any patient of mine. Even if you think they are anxious, check out what they are saying so nothing gets missed and you can allay their fears. While you were putting the epidural in, I was thinking, why are you doing this? If you don't stop my bleeding, the epidural will be pointless. I had to endure another half hour of terror while you all went about your business because you all thought you didn't need to listen to your patient. All this time I was constantly dripping into the pad and watching the monitor. During the whole time, not one of you took me seriously. Not one of you spoke to me directly. Not one of you gave me any comfort or said, "Don't worry, we hear you." All you did was exchange glances with each other that just said, "Anxious patient." Regardless of what my obs were saying, I was already showing by my demeanour that things were starting to go wrong. Unless you have a sudden collapse, a change in demeanour or conscious level is your first sign of deterioration, and you all ignored it. I sat there while Dr. S put an orange cannula into my right ACF and attached a litre of Hartmann's. You just smiled at me and said, "There, you'll be happy now you've got a large one in." Why in this whole time did not one of you check my blood loss, run off a blood gas when you had cannulated me, which would have given you very quickly a haemoglobin? Why did none of you think to give me IV tranexamic acid? This only takes 1 minute to do. Few contraindications, same dose for all adults, and available in the anaesthetic room. This was something I was doing on a daily basis, so I know how easy and quick it is to give. Why the clear fluids? The gold standard for blood loss is blood, and there is no point in giving me anything else, especially when there were 4 units of blood ready for me. The whole time in the anaesthetic room, no one stood up to be my advocate, and it was the responsibility of all of you to keep me safe, and you all chose not to. This I do not understand. Between the 2 units I had bled for over an hour, and no one had checked my blood loss. I was swimming on a river of blood. You, Dr. H, stood on the left of me, and the ODP was on my right. As you pushed me into the theatre, I said to you both, "Have you got the blood ready?" Because I knew you were going to have to act fast. You just exchanged a glance right over the top of me. It said, "Anxious patients, let's just get her to sleep." It was awful. You then just gave me fentanyl and someone put an oxygen mask on my face. I took it off and said, "Guys, if I never see you again, thanks for what you're about to do." How much clearer did I have to be? Has anyone ever said that to you before? I knew what was about to happen when you took away my ability to compensate. Still, you all ignored me. As still in all this time no one has spoken to me about what happened in theatre, I have to ask these questions. It may seem odd to you, but I need this for closure. What did it feel like when you suddenly had to do CPR? What did it feel like when you finally looked at my blood loss? Did you all just say, "Oh shit, she was right," and we ignored her? I guess it wasn't quite so funny anymore, ignoring me, was it? How did it feel when you all had to run around checking my haemoglobin, putting up tranexamic acid, getting the blood? everything that I could have had in the anaesthetic room if you'd taken me seriously. Did any of you have a pang of remorse or conscience that you had let so much harm befall a patient? For me, the cardiac arrest is not the most important thing. If you had all treated me with respect as a patient, had listened to me, had got my surgeon to see me, had started the tranexamic acid, with or without blood, had taken me seriously, and then I'd had the cardiac arrest, I could have accepted it, as I would have seen that you had tried your hardest to prevent it. I deal with patients all the time who come in so sick or so badly injured that however quick we are with the right treatment, we just cannot save them, and this I accept. But for my colleagues to do this to me, it's almost unbearable. The next thing I remember is my nose being really dry and pulling at a tube. Someone said, "Don't pull at the O2, you're in intensive care, you had a cardiac arrest." From that moment on, I was wide awake and have remained so ever since. It had happened, and no one was ever going to harm me again. I remember touching my sternum, which felt bruised, and thinking, that's what CPR feels like. I then realised I had a central line in the right side of my neck, a green cannula in my left wrist. Obviously, I'd been very poorly. My surgeon came to see me in the evening. He looked tired and dishevelled. He said, "You lost a lot of blood." The following morning you came to see me in intensive care. As soon as you walked through the door, I said, "I told you I was bleeding badly." And you said, "Yes, you did." It was a "yes, you did, and I didn't listen to you," not a "yes, you did, but you were wrong about your blood loss." You looked awful, pale and shaky, probably worse than I did. You told me you thought you'd broken a rib, but you hadn't. Actually, you had, but I'm not in the slightest bit bothered. It happens, I know. You also said you realised that you should have got my surgeon to look at me before anaesthetising me. I knew that probably neither of us had all the questions or answers we needed at the time, but I was still grateful that you had the guts to come down. No one else had or has since. I just need to know more. The nightmares, flashbacks and disturbed nights started almost straight away. I had hoped that they would fade, but as you can see over a year later, I can still recall every second of what was over an hour of terror, even the glances and which cannula went where. All the speech is in inverted commas because I can remember every word. I then made an official complaint as I felt it was too serious an incident and it could have been prevented. This was not just for me, but for any patient that came after me. I saw my surgeon for my post-op follow-up and he said, "Do you understand about your cardiac arrest? It was because you had become so dry." I had a phone call from the director of nursing who asked me to come to the complaints meeting, as, in her words, it's really powerful for those involved to see and hear how it felt. My partner and I spent a long time putting questions together as I wanted and needed answers. The meeting was held in the anaesthetic department, a really poor choice as most of my trauma had been in an anaesthetic room with an anaesthetist. A large table acting as a barrier, with hospital staff on one side, my partner and I on the other. Imagine my dismay when I realised that no one from the original vents were there. What was the point? No one could answer my questions. The only one who could were those involved. I understand you were on leave, but could you not have found it in your heart to attend? It was not only you, there were 3 other people in the anaesthetic room, and also no show from the nurse on B32. Was it your decision not to come, or a managerial one? Did none of you think that you owed me an explanation, or was the horror of the event too much? I was already on edge because I'd been lied to before the meeting had begun. Although the nurses made a reasonable attempt at honesty, I knew they were not being completely candid. Who chose Dr. T to lead? He was an absolute disaster. He was the main reason I took this further. He was dishonest, dismissive and disrespectful to me as a patient and a colleague, which to me is even worse. I asked why you had not taken me seriously. He said, nurses and doctors make the worst patients. What kind of answer was that? He said that I had not lost a lot of blood, that I'd overestimated, and went to great lengths to tell me about a research project which shows people cannot estimate correctly. He told me that I had not had a cardiac arrest at all. I'd still been showing a rhythm on the ECG machine, I just had no pulse. That is, by definition, a PEA cardiac arrest. I told him that you had told me I'd had a cardiac arrest, and that my surgeon had told me twice. I also said it's written on the front of my chart in large capital letters. He said he would get you to change your terminology. He also told me my haemoglobin was 99, which I knew was untrue because it had been 92 the day before, and that was before I'd started to bleed again. Did he think I was an idiot? I asked why I'd had a transfusion of 4 units of blood, as with a haemoglobin of 99 I would not have needed one. He said I must have bled out during the operation, but my surgeon said that he'd had a clear field and the swab count showed a blood loss of only 452 mils, so also untrue. The whole meeting was a catastrophe. I ended it as I knew I needed to get my medical records to prove the lies. I was so hurt and disgusted that they had done this to me, as a patient, but mostly as a colleague. Complaints meetings are supposed to be truthful, even if that is unpleasant, and a way to sort out things, but no one wanted to do this. I had to wait a further 2 weeks for my medical notes. Although I was by now showing significant signs of post-traumatic stress disorder to staff, no one did anything. I still had to endure months of treatment in the hospital where I no longer felt safe and trusted no one. I tried to transfer twice, but was not allowed to. Fortunately, another department realised that I was having problems and referred me straight away to the trauma psychologist. So while all of you had had debriefings, support from your colleagues, managers, unions, I as a patient was left to pick up the pieces alone. 8 weeks after the event, I saw the therapist for the first time. I explained what had happened. He said he had never heard anyone recall a traumatic event so vividly, so many weeks after it had happened. He said I'd been so affected because 1, there had been a delay in referral, 2, it was a preventable event, 3, my colleagues had done it to me, and 4, there was no resolution with the complaint. When I went to see my medical records, which was another unnecessary delay, just making my anger worse, imagine my complete disbelief when I found that the nurse on B32 had written nothing about the entire event. I then looked at the anaesthetic sheet and saw to my horror that it no longer said PEA cardiac arrest on the front, nor A&E nurse. These were the 2 things that I'd had words with the chairman about. Who would do such a thing? I immediately told the head of complaints and the head of medical records, but they said nothing. I just sat there stunned and even more wary. Then I saw that you had written nothing to say that I'd been escalated, nothing that I'd said I was bleeding badly. The pad I'd been sitting on had just been thrown away with no mention of it, just blood and clots in vagina written down. The pad could and should have been weighed, so there could have been no question as to the amount. Was this done deliberately to conceal the amount? Or did someone weigh it and then thought it was better to get rid of it because of the weight? The initial dose of propofol at induction was not written in, although all the other drugs had been, and their correct dose was written. If I had died in theatre, neither my family or the coroner would have been any of the wiser. Would any of you have been truthful as to the events, or would there have been this wall of silence that I still have now? What would have been said if nothing had been written down, and the pad with the evidence just thrown away? Also, if I died in theatre, you would have been compelled to go to the inquest, leave or not, and my family would have heard the answers. Why, just because I am still alive, will no one give me any answers and give me peace of mind? I saw the blood gas result from just after my cardiac arrest, and my haemoglobin was 73, not 99. It was just a blatant lie. My haemoglobin has never been 99 while I was in the hospital. Tranexamic acid was given straight away. All the electronic notes were missing. If I had not been such an experienced nurse, I might not have known this, but I knew what I was looking for. Was this accidental or another cover-up? I had to wait another 48 hours for them. I was given a transcript of the notes of the first meeting. and that was littered with errors and omissions, appraisy at best and untrue at worst. When I got the electronic records, I could see that I'd had 2 units of blood just over half an hour, just as the operation was started. I noted as well that more blood had been ordered and that I'd had 2 units of fresh plasma before another 2 units of blood. How did Dr. T think I would not ask for my medical records and then take this further? I really struggled to get a second meeting and had to resort to writing to the CEO and my MP. I should not have needed to do this. Still no resolution, although the nurses admitted things because they had no choice when I presented them with my notes. The head of surgery just admitted the haemoglobin was 73. Otherwise, a complete wall of silence from the medics to this day, except from a glimmer of hope from my surgeon. It just felt like, and still feels like, the Royal United Hospital is rotten to the core. I understand you took me to intensive care, and it is clear from their handover notes that you had told them that I knew I was bleeding before the operation. Why did you not write it in your notes? Were you too embarrassed? It also said that my estimated blood loss was 400 mils. But if Dr. T said to me that people cannot properly estimate blood loss, then this applies to you too. There was one way of having this correct, and that was to weigh the pad and subtract it from an empty pad. This is standard procedure in theatre with swabs, and it applies to pads. The only reason I can think of that this was not done is that the blood loss was obviously more, and no one wants to admit it. I have to think this, as no one is prepared to give me any answers. Remember, all the blood on the pad did not include the blood in the toilet on B32. I then felt I had to refer to the Ombudsman, as I did not want to keep this hidden in the Royal United Hospital. They did not even look at the complaint for 3 months. And even then I knew I'd not get the answers. It is really difficult when people have not written anything in the notes, or when they have written things that are not true, as people believe nurses and doctors. I was already having serious anger issues. This was no longer just about the original event. It was about how the complaint was handled and the continuing wall of silence to me as a colleague. Can you imagine how it felt to keep coming in for treatment when I did not feel safe? Over a year on and still no resolution. There has been no apology from anyone involved. A managerial attempt means nothing. Does no one think I deserve one? I want all of you to know the consequences of your actions and inactions do not end on that day. Your duty to me did not stop when you handed me over to intensive care. This is how post-traumatic stress disorder feels. I've not had a full night's sleep. Although the terror has gone, I'm lucky to string together 4 hours, always awake thinking about things. I can still recall every second. Every day my thoughts are in the Royal United Hospital, unless I am really busy, but as soon as I am not, the thoughts are back. I have terrible outbursts of anger. Again, better than they were, but still unpredictable. I shout and scream, use foul language repeatedly, and sometimes feel like I have Tourette's. Sobbing for hours, picking fights with people far bigger than me, and doing stupid, risky things that I would never have done before. My 22-year-long relationship is in tatters. Do you know how hard I am to live with? I'm no longer able to work in resus. I've tried the odd shift, but I no longer have any trust in anaesthetists, which I'd love to work with before in traumas. Doing CPR, even on training days, is stressful. Drawing up propofol makes me shaky, and the mention of tranexamic acid makes me tearful. I am still managing to do some work in triage and minor injuries, but all the time I'm listening out for other people's patients to make sure they haven't missed anything. It's exhausting. My relationship with senior colleagues who I know are involved in the complaints procedures are now ruined, because I know now what they do to try to get out of complaints, and this I cannot reconcile. This has destroyed my nursing soul. There are staff at the RUH who have just stood and watched me deteriorate mentally and then physically without intervening, and this I cannot understand. In May 2018, my surgeon saw me outside of the complaints framework, as he knew I was struggling. I could see he was surprised at my weight loss. I weighed 95 kilograms on the day of my operation, and then was down to 72 kilograms. He said he had no idea why the complaints had not sorted this out, and his exact words were, "Everyone involved in this knows your cardiac arrest was due to your blood loss." I asked him to go to the complaints and put a stop to this. It does not look like he has done it, and though he appears to want to leave me in no doubt, he just sits there silently with his colleagues. If I had been involved in an event where everybody had been killed, I would have been able to have coped with no answers. But everyone at the RUH has the answers, but will not give them to me. Why would anyone want to leave a patient in such a state? I have no idea if it was your choice to not come to the meetings, or your managers. Have you known of my struggles, or just been oblivious? I find it hard to believe that you have not been kept informed. Do you care? I have asked repeatedly for meetings with all those involved, and complaints have just said no, and no to the Ombudsman, even though I have said I will wait for your leave to be over, as this has dragged on for so long. This is not about money. It's never been about money, and everyone knows this from the start. I loathe the compensation culture. It achieves nothing. I just want a full night's sleep, not to be able to remember everything and not to be so angry. I only have two emotions, anger and sadness. There's no joy anymore, no laughter. Do any of you still think about this event, or are you just carrying on, oblivious of the legacy? Does anyone actually care? All I have seen is that the staff have been cared for, and no one gives a second thought to the patient. I'm still hopeful that someone involved will have the heart to give me answers, so I can at least get closure. I am now a tired, miserable and angry bag of bones weighing 54 kilograms, who has to continually exercise to keep the anger in check. I will now do everything I can to highlight this event and to try to make sure it never happens to another patient, to highlight the lack of honesty in the complaints meetings so no trust thinks they can do this, and to highlight that there has to be support for patients caught up in a critical incident, not just staff, and I am speaking as a member of staff. If the memories of this event fade, the one thing I will always remember is the glance you shared with the ODP right over me when I said, "Do you have the blood ready?" and how a few minutes later you realised that I did need it. Do not ever let this happen to another patient.